Hey, welcome back to Operations Utopia. I'm Matt Neal. Today I'm talking with Jeff Sovis. He's the founder of Mindful FDA. Jeff has a phrase for the gap between what your validation paperwork says and what your organization is actually doing. And once you have the word, you start seeing it everywhere. It's called operational drift. We talked about that and some other validation type topics. So enjoy my conversation with Jeff Sovis.
What triggered me to reach out to you was the operational integrity versus like pure validation play and standing up on documentation that says we did something that actually doesn't prove that it's going to do what we wanted it to do. And I was like, yeah, exactly. That's you made very good points about that I wanted to expand on.
Right. Yeah. 6 or 7 years ago, I was working to harmonize one of the biggest companies in the world. A single instance of MasterControl. And I was the validation lead, so I was able to see everything that and I was also able to see in the meetings through the executive leadership and everything what was actually going wrong. Which it was almost never in the validation document.
Yeah.
We were finding issues, fixing them, but there were a lot of operational communication things. Obviously, divestitures, mergers, there's a ton of that stuff. And even just throughout everyday operations and growth, the decisions that get made, they can create like what I would call operational drift. Because when different stakeholders are involved with different backgrounds, depending on educations and stuff, and when that's brought into ownership, there can just be competing priorities, and some people are operating in silos of what they're experts in, even though there might be something else on the other side of the organization that can create a lot of confusion. And documents can get split, documents can get lost, stuff like that.
So is it, would you agree with the statement then that like there's the illusion of validation through documentation rather than ensuring that the objective is met with the systems that you validate?
Right, absolutely. Overall, especially, I mean, obviously, the higher categories are a whole nother beast and more complicated. But for category 3 specifically, which is a lot of software companies, especially if they're virtual and stuff like that, so the category 3 is the most prevalent, which a lot of the risk, it correlates directly to the business process. So validation has kind of become like a checkbox exercise, just something we need to pass to move. But in reality, it can be used as a tool to figure out your ways in and out of every possible situation and create a more seamless operating environment throughout implementation, and as well as post go live. It's just as important because there's new features coming online. There's all the different types of decisions that need to be made.
So how's it been going with, what's been the reception on this idea of, and maybe expound a little bit on, is there a shift to a different way to think about these things under operational integrity versus validation? And like, where do you kind of draw the line on, where you start to maximize that thinking instead of focusing on the paperwork, basically.
Right, right. Yeah. So that's what I'm talking to people like you about, talking to as many people in my network, just where this falls into the scheme of things, because there's a ton of components to it. Um, it's an education issue. It's a cross-departmental issue, a lot of QA, IT. Um, so it's like, is it a new uh, department that's part of quality? Is it more of a framework that aligns with a lot of GAMP and FDA guidance, but creates um, a simpler way to think about different categories software in
Hmm.
terms of um, creating these test cases and planning appropriately across um, these business situations that are then reflected in validation, SOP writing, training, um, across the board.
Hmm.
So that's, I mean, I'm just taking basically the biggest lesson that I've learned and trying to figure out where it.
How how do you think we could convince quality organizations to adjust to the paradigm and move focus? Because one of the things that I've seen in a few organizations is that there seems to be a desire to have a blanket standard approach when it comes to quality, and kind of putting every system in the same exact category and treating everything the same. And I just, that doesn't seem to make sense to me anymore. Even within the realm of the things that typically fall under quality, I think the intention of the rules and the intention of the guidance is to make sure you maintain quality of drug product, patient safety. But we do this process to all kinds of things. Any computer that touches any part of this, whether it makes sense or has an impact on it or not, seems to get kind of broad brushed uh, into a tough spot when it comes to quality. So, like, moving to risk-based computer system validation is helpful, but it still feels like overkill in modern SaaS systems, and from my view, actually increases risk, because the longer you're not operating at an optimal level, the longer you're creating risk, right? And
Oh,
you
yeah.
know,
And I think it compounds um, if, if you're not keeping up with things. Um, and I mean, yeah, I would say now is a good time to find people who, because obviously validation, CSA is kind of, people are coming from different backgrounds. It's kind of split. These, there's multiple ways of thinking about it.
yeah.
Um, so I think that aligning with people that have this philosophy and seeing uh, what their take is, people with like day-to-day scientific IT backgrounds, uh, and just investing a little bit in them, like
Mm-hmm.
not even a contractor, or like a 20-hour a week contractor or a full-time employee, but just taking someone who has a lot of experience and having them come in and do something like an operational integrity assessment that lasts 2 or 3 weeks, and they go through a 20-page report focusing on the systems, the testing, the procedures, everything, and uh, just getting like actionable feedback with almost no investment at all.
Yeah,
I
yeah,
mean, yeah, it's just a matter of making sure that the philosophies are aligning.
yeah.
Um,
What would you say has been, kind of the feedback that you're getting, and are you seeing any uptake on these philosophies starting to take root?
yeah, I've had personally, I'm starting to get more, uh, which is my favorite part of the job, and that's uh, for me, that's validation, and it's the most fun thing.
Hmm.
Uh, I'm also starting to connect with other validation people who have seen the same things,
Yeah.
and the philosophy resonates with them.
Hmm.
Um, Obviously, a lot of times there are specific problems that need to be solved in those three. Um, but in terms of just like interest across the board, it's definitely ticking up
Yeah.
for something that's still relatively new.
Do you think that I've been observing that we kind of are we're stuck for a very long time in the paradigm of like on-premise system validation. We kind of pulled that into the world of SaaS application platform validation, and that kind of made it messy and murky and overkill. Um, and now, where that, even if you got that stable and streamlined, now we have this whole new player with AI. And how do you validate AI stuff when
Mhm.
it's generating new stuff every single time you touch it? If we're talking about LLMs, for example, very difficult to validate, even in the most aggressive risk-based paradigm. It's tough to really pin that down. So I'd love to know what your thoughts are there as we evolve in that way. And then, yeah, so then I'll have another idea after that, but I wanted to get your take on that.
Okay, cool. Yeah, it's been crazy in like I remember 2017, my first merger on a single instance of another software. Um, and we're using the V model, creating requirements and basically reflecting them in an out of the box package.
Yeah.
Um, and we weren't using a sandbox or validation environment. Um, and the test scripts were due before we even had access to the system.
Right. Right.
Um, so there were just so many issues created by that model in general. I'm not saying it's totally irrelevant, especially as software gets easier to build
Yeah.
for these higher categories. I think that stuff can be, but for like an EQMS category 3, the stuff we're talking about, it just created very cumbersome projects. And then seeing that fast forward to today, where we're able to get users into like sandbox validation environments, especially sandbox, which is an unregulated
Yeah.
environment, and just hopping in there, using it for education, stuff
Hmm.
like that. It just creates a like sky's the limit potential
Yeah.
in terms of like moving this stuff forward with the right operating model.
Yeah.
Um, so yeah, and then in terms of AI, um, so I talk to a lot of people about this, and they've got kind of different philosophies, um, and there's different companies involved too that are like kind of like kind of software companies like
Hmm.
TetraScience, stuff like that, um, that all have different tools and stuff. I mean, from my background, I have a general take from like working day to day in these companies, like how it can be useful with a limited amount of risk, and it's something I've worked with another partner on in their tool. Um, but I'm basically, in terms of how I think it can make organizations better, it's human in the loop. So using it as, at this point, even starting it as an outside system, not connected to anything,
Yeah.
and basically using it as like an education uh, tool and like I would say like a trust exercise throughout the organization, because obviously we're scientists. Um, like we didn't grow up. We grew up using Google. We didn't that.
Yeah. Yeah.
Um, so having people in those tools using their day-to-day workflows, um, obviously that makes the risk is the LLMs using the data incorrectly, basically. But the fact that a human would have to take it from the outside system to the inside system,
Yeah.
that eliminates almost all the
Mm.
risk. Um, so just from like a traditional QA philosophy, that's like the most powerful thing.
Yeah.
And it's just going to get more complicated from there, obviously. That's a pretty
Yeah. I mean,
wild.
it's going to get crazy when we allow AI to operate in the system, to
Yeah,
operate where the humans did operate. If an agent has access to perform a process, um, you you make fragile what was fragile due to error. It's exactly the same risk in a way. So this is where I start to get interested, right? Is like we're going to hold AI to a different standard than we would hold humans if we're going to allow them to be autonomous and operate on our behalf. And
right.
we have to adjust the way we think about uh, implementing it, monitoring it, and managing it, from my view. Because right now, if we took a process-driven quality system to, like, just say, move a change control through all of its approvals, right? Um, Many parts of that are clickable. Approve this, drop this document there, do an impact assessment, type something, click through. You know, it's very human centered clicky buttons processes. Um, that doesn't mean that mistakes don't happen, but the scale of those mistakes is somewhat controlled because you can only go so fast. Whereas if you could automate it and not have oversight, any kind of drift could very quickly become a
Right,
major problem, right? So
right.
we have to hold it to a higher standard if we're not going to watch it like we would watch the steps or be able to intervene sooner. So it's getting really really interesting because on one hand, I don't want to waste time where validation is overkill, but we want to apply it extremely diligently. And I think that's where your operational integrity comes into play, which is like we may have to, drop in at different points for different things to validate and check and monitor, as opposed to the day you install it, you validate everything, you ran your requirements, and you're good to go, and you just walk away. I don't think we can live in that world either.
Hmm.
So it's not just make the paperwork easier to get to that validation state. It's, oh, I think we're in an always on monitoring process state,
For sure,
and
for sure. Yeah,
yeah,
I'm hearing a lot about continuous validation. The other thing is that, yeah, I find these conversations always interesting too because this stuff is so new
Yeah.
And I think there's a big line between like AI and automation.
Mm-hmm.
Because to me, I mean, those are two totally different things. Like automation, you can prove works correctly. And to me, AI, there's a third unknown entity making final decisions. That to me is a suspect case. I
Yeah.
think humans are always needed. Um,
Or,
and yeah,
or an agent performing automated steps or orchestrating automation, right? So there's a lot of ways to play it, and it seems like it changes about every 2 months in what the capability is now. Whether we would have been programming an MCP 2 months ago, well, now maybe that's not the way to go, right? So 6 months ago, we really didn't have an agentic framework that we could rely on. Now we have one, and you're like, oh, well, maybe we need more agents and sub agents and make the agents even more granular until they can't screw up because we box them in so small. So it's pretty wild. So I think keeping your eye, which is why I like your topic, is keep your eye on the point. Keep your eye on what is all this supposed to lead to, and apply the validation and the quality checking where you have problems and leaks, right? And very, very critically look at why you're doing it in a way.
exactly. Yeah, this stuff, I mean, especially this automation stuff, it's really the nitty gritty, um, and understanding it operationally inside and out is obviously the most important thing.
Yeah.
The other thing I think is educating across the organization. I think that's still way underutilized.
Yeah. 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 So let's switch gears a little bit. I want to talk a little bit about you're the founder of Mindful FDA, and I'd like to know more about that.
Thank you. Yeah, so I founded Mindful FDA in 2015. Um, I'm someone who I started in the lab, actually manufacturing Carticel and Epicel at Genzyme Biosurgery for burn victims and stuff like that. Um, at the time I started my LLC, I had my contract renewed 3 or 4 times, and ultimately got on one of these projects. So I've been doing this now for about 12 years. Um, so I spend a lot of time talking to people and learning about their experience and what's going on in their organization. Um, that's my favorite part of the job, and coming up with solutions that make sense across the board. And it's really, this episode has been kind of exactly what we do. A lot of
Nice.
times it's stuff it might be purchased under different names traditionally, like audits or
Okay.
SOP harmonization, stuff like that. Even like mergers and acquisitions or like continuous operations, um, software upgrades. So it's all that traditional stuff, but it's under more of like a framework from a company with like hands-on in.
I see. Very cool. Very cool. So, um, what trends have you been seeing in terms of the shifts in organizations um, to this model? Like, do you feel like we're at the early front end of this type of revolution, if you want to call it that, or are we, what's your take on where we're at in this journey?
Yeah, I think, I mean, even though huge progress has been made since 2016, 2017, um, I still think we're basically at square one.
Hmm.
Um, from the conversations that I have, um, there's still a huge amount of misunderstanding, um, especially in terms of the roles and responsibilities between quality, IT, um, and how they interface with the rest of the organization in terms of everyone's day-to-day responsibilities and how they work together. I almost never see two organizations doing it the same way.
Yeah.
Um, so that's really the trend that I see. And in terms of implementations, I see kind of the gambit. Um, everything from there's some super AI first companies that they're typically very heavily funded and are doing some really interesting things with some potentially groundbreaking use cases.
Mm-hmm.
Um, and then there's a lot of companies um, are just kind of using AI at like the enterprise level. Um,
Hmm.
and then a lot of other companies are kind of doing things that make sense across the board, financially, operationally, um, and having investments that are really targeted in driving better outcomes, more compliant solutions, and a better operation. And yeah, those are the companies uh, that I've seen that are typically the most successful as well.
Yeah. Now, on the roles and responsibilities, kind of the disconnect there, it feels a little bit to me like they're in a position where they're kind of set up to fail from the get go, um, and we keep trying to make this model work because, well, IT folks are the techies; they can fix the thing. Quality's there to make sure that everything is up to spec, validation, quality control, and then you have the business that doesn't know how either of those work, and they all have to communicate. And I find that to be one of the biggest frustrations um, that the business can face is trying to speak those different languages, if you will, across the board um, within organizations to get to a point where you can have operational integrity. Um, So I wonder how that strikes you in terms of you kind of mentioned it, comes down to education type things and roles people play. But I wonder how much of it is, I don't know if we're ever going to get to a good spot here because, take a scientific role with 15 years of experience, that business person has got to condense that experience to explain it to a requirement because requirement is needed for IT to fix something. And then quality says, did it meet your requirement? and the businesses will like, well, not really.
Yeah,
But, so,
yeah, yeah, yeah.
it's pretty
It's
crazy.
because organizations, biotech organizations, weren't built for this. I mean, most of these companies, technology wasn't even in these enterprises 10, 15 years ago, like
Yeah. Yeah.
using file cabinets.
Yeah. Yeah.
Um, so making that transition is legitimately impossible. It's what's needed is like the same thing that's kind of happening in sports. And
Hmm.
as like the younger generation gets older, like people that can go out there and do a little bit of everything and understand a little bit
Hmm.
of everything, as opposed to the departments just operating in silos.
Yeah.
And I mean, one of the most basic things is just like who has operated as a GXP employee before, who has not.
Hmm.
Because I mean, these systems aren't really an opportunity to be like take someone who's never worked in GXP and be like, you're now GXP.
Right.
Uh, like, yeah, I've seen that on audit findings.
Hmm.
Um, so stuff like that. That's not to say that like there are plenty of IT people who have GXP.
Sure, sure.
It's like, yeah, there's just a lot there in that gray area, and it had never been there before.
Yeah.
And now it's just there, and it can create a bunch of operational issues that, yeah, usually maybe the FDA wouldn't come in and make you stop doing something for, but they can create all other types of issues,
Yeah.
from finding stuff to a number of other things.
Yeah. All right. So what would you say is your most interesting validation or inspection finding that you were surprised by?
I've been surprised by a lot. I mean, I've come into certain EQMS providers, and the provider is saying they're ready for go live, and I go in to test, and the workflows are not even functional, let alone like having SOPs that make sense or training stuff.
Yeah.
So that would be one. I mean, also just working with like different parts of the organization that might not be aware of something else that's happening on the other side, where there's naming convention, like duplicates, like
Yeah,
stuff like that. That just, and then the documents end up in both places.
Isn't that wild?
Yeah, yeah. It's all it's yeah, it's stuff that can create a huge problem if you need it, or if or it's omitted from a package and there's turnover in the organization.
Well, I just think it's wild, and I don't know why more people don't understand it. Like, so think about like just the life cycle of a product at a biotech company or a pharma company, from the time you're in the lab to the time you're like marketed product is years. It's years, like a decade, right?
Right.
So even if we got that to be 7 years or 5 years, however you do it, you're still assuming that the custody of the information for that product is held steady for that period of time. So to think that you could rely on a single human to stay in the job and handle it across that time, it has to be handled across time. And it's just fascinating to me that isn't like the CTO or the CIO of every single company just screaming from the rooftops like,
I know.
hey, this information has to be kept over time across departments. Like it's fundamental.
Yeah, just having that hanging out there is scary.
Yeah.
Yeah, for lack of a better term. And yeah, I think that just
That's all good.
um,
We're saying the CEO, CIO, or the CTO should be very clear that the long life cycle of chain of custody can't rely on single humans.
right. Yeah, because so the last mile is almost always the most difficult part of these projects. It's difficult to be identified up front, and like people reach a milestone and it's easy to just say like, okay, we're done. And then what happens is that creates a workaround, and the workaround ends up basically becoming someone's job,
Yeah.
when that resource could be used making everything better. Um, so yeah, it's not like over allocation or anything. It's misallocation, because it could be going in the opposite direction in terms of improvement.
Yeah. It's a wild landscape out there. So I'm very happy to see your content and your the information you're putting out there. I think these are conversations that have to evolve across our our industry, even though it's very small. I think we could make a big difference, and one of the reasons I'm trying to just have more of these conversations is to just put ideas out there so people start thinking through these a little bit differently. Zoom out a little bit on the problems that we all encounter. So I really appreciate your time today in chatting through this. Is there anything else that you wanted to cover or plug or talk about?
No, I just appreciate your time. It's been really fun just getting to talk to someone else who's a hands-on expert in the field, and is also seeing similar things. So yeah, this type of thing is my favorite part of the job, and I look forward to hopefully speaking again in a couple months or whatever.
All right. Very cool. Thank you, Jeff.
Thanks, Matt.